This is Pop Health Week on Healthcare Now Radio. I'm Greg Masters, Managing Director of Health Innovation Media, the executive producer and co-host of the show. Joining me in the virtual studio is co-founder and principal co-host Fred Goldstein, president of Accountable Health, LLC. At Pop Health Week, we engage industry leadership and stakeholder voices spanning payer, provider, patient vendor, and regulatory communities in population health best practices and strategy. Connect with us via www.popupstudios.productions or follow and direct message me on Twitter at GregMastersMPH, and that is Greg with 2 G's. On today's episode, our guest is Astria Goolsby, the owner and founder at Verve Health Station. A graduate of the University of Mississippi, Astria served as a fitness professional for over 15 years as the owner of Verve LLC, Verve Health Station, and adjunct instructor. She is dedicated to helping Mississippians overcome the challenges and barriers that arise when sustaining healthy lifestyle changes. For over 13 years, Astria has been dedicated to the fitness industry. With experience training, general population, limited mobility, children, and athletes, Astria has serviced North to South Mississippi. Providing training certification courses and being an adjunct instructor has earned her the recognition of the finalist for the nation's Trainer of the Year and 2018 January Trainer of the Month. And with that introduction, Fred, over to you.
Thanks so much, Greg and Astria. Welcome to Pop Health Week.
Thank you. Thank you for having me.
It's a pleasure. Got a chance, obviously, to meet you at the University of Mississippi at the School of Population Health. Had a fascinating discussion with you and thought, boy, I'd love to share this stuff with our audience. So why don't we start? Give us a little bit of your background.
Well, by training, I am a professional trainer, personal trainer, fitness. I came out of the University of Mississippi Exercise Science Department, and I've been working with different businesses and organizations on implementing and sustaining health and fitness programs. It's kind of an interesting path that my background did take. So as I've trained people, I've also put together programs or helped to establish programs to which I can work them and other trainers can work them. So I kind of taken that path and I like it. I like what I'm doing with this. And so we're still doing it.
Yeah, and I understand, as we talked, your programs, you really try to take these into some of the underserved communities.
Yes, we really, when I first started in fitness industry in college, and the first client that I had, it kind of hit me through the experience of how valuable a personal trainer can be. And I thought to myself, for what I need to be paid to live, that's a hard payment to ask of someone for a personal trainer, right? And I thought to myself, so many people who can't afford personal trainers, they need one, if not just for the beginning of fitness and health journey to help them to navigate it and to understand what's happening as they navigate this journey, but they need it. And so my kind of fight has been to create these programs for underserved communities where fitness trainers fit into that and they can get quality training.
So can you give us some examples of maybe where you've worked with this or some of the things you've done or some of the unique experiences around that?
I think the most notable one would be with Tougaloo College. They called and they had a fitness center on their campus that they needed someone to operate and to assist them with data gathering from the use of the facility and to help expand the branding of the facility on the campus, get the awareness out to the students, get more utilization up. And so when I came in, I saw an opportunity to provide work study positions for students, as I've seen on other college campuses. But I think the most interesting thing fun thing that I did when I was there was that I established an exercise leadership program in which people who wanted to be a trainer could come to Tougaloo College Fitness Facility. And as they're going through the workshops to become a certified trainer, I would allow them to train people and they could get tips from these clients as they're going through their training and kind of implement some of the things that they're learning through their courses, save that money, and that money goes towards their certification class. And so by the time you're done with the workshop, you've trained enough people and the community supported them to tip them enough to where they would pay for it. and they had a chance to really understand training people in the underserved communities, because we had seniors that were 90 years old to students that are 18, visually impaired individuals. We also had individuals who've had strokes and couldn't use the left side of their bodies. So many different ways that they could really experience training in different community levels.
So what sort of things do we need to begin considering if we want to take these kinds of programs and get them out into the communities that really need access to these things, particularly given that perhaps we don't even have facilities there or places like that?
I think the number one thing to get out into the community, if you want to bring these types of programs, is it really does. To start these types of programs, it takes a community effort, or it takes a heart, because to get these things started, I think this is really new when it comes to fitness trainers really being utilized in grant funding programs in this manner, in this capacity. I think that we really have to look at trainers understanding what their roles are in these positions and understanding the different communities that they're serving.
Uh-huh. And as you work with these, I know you also work with schools besides the universities. Is that true as well?
Yes, so I did work with the Oxford School District. I've worked with them. We had trainers and exercise instructors that came in to train the faculty and staff for the school district in their athletic facility. I'm working with UMC, and we are developing diabetes prevention programs, a digital intervention for students in public schools across Mississippi. And that just opens the doors. That's one of those things of me as a trainer understanding how to, the type of programs that are needed in these areas, to open a door for more physical activity to come in, and then open a door for those trainers to come in and understand training students or children who are at risk for diabetes, and how that might be different from training someone who just wants to, or who wants a six-pack, versus someone who needs it for being able to process glucose and insulin.
Mm-hmm. So tell me a little bit more about this. Obviously, the DPP program has been out there for a while, particularly for adults, approved federal program for diabetes prevention. And then we've now seen apps move into this. But children's sort of a new area, isn't it, to take this into?
It is a very new area. As a matter of fact, I remember when we were researching the DPP and looking at what they had for children, it's not much out there. There hasn't been a lot of research done around what is effective and what's needed, or to build any programs surrounding diabetes prevention for children. And so we've taken this on we're mirroring the current DPP, and we're looking at behavioral change techniques for children that are been found effective for children, and lifestyle change. And we're kind of mirroring that, and we're creating a diabetes prevention program for children, utilizing what's in the DPP and the way that they guide adults through diabetes prevention.
So you talked about, trying to develop this for kids. Are there some unique aspects of it that you're building into it that maybe wouldn't be there, say, for an adult?
Yes, I would say a lot of it is taken into consideration of advocating for self is something that we really want to stress about, how to communicate with adults about so when selecting what you want to eat, let's say when you're at McDonald's or when you're at the grocery store, because kids don't pay for the groceries, right? And a lot of kids don't provide the food that goes on the table. And so when you're speaking to your parents, how do I have that conversation with my parent if I'm trying to be healthier? I prefer banana for a snack versus the candy that we have that's sitting on the table. So advocating for their self when it comes to making healthier choices, and as well as working with the parents as well to be able to understand when their child is trying to advocate for themselves, kind of making sure that we're looking at where that barrier comes in and kind of what's happening there, because we do know that there is a communication portal for children to be able to clearly convey to their parents, I want to be healthier, but what does that look like? And how do we recognize that with kids? Because it could be frustrating, right? When you've bought this food and your kid says, I don't want to eat this, I want a banana, instead of the chips you've been buying for 15 years. So,
right.
Yeah.
And is there a certain age that it's going to go down to? Is it going to be very young, or is it teens, or what do you think about from that perspective?
Well, we are going to develop this digital intervention for pre-K through 12th grade. We're starting with 10th and 11th grade. Because they're the closest to adults, and we were looking at 12th graders, but 12th graders are going to kind of phase out to be able to get that review or to get those updates, or what are those recommendations that you think that we should change to make this better for children. So once they graduate, it's a little harder to keep in contact. So we've decided to go with 10th and 11th graders. And that makes the mapping from the DPP, the adult DPP, a little easier for that transition. And then we're going to just work backwards from there.
Great. And you talked a little bit about, obviously, the parents being involved. Is this going to link to the parents too, or is it just going to be that the child communicates with the parents and uses the app?
So, of course, we're going to let the parents know what the children will be engaging in before, during, and after they've actually engaged in their lesson for that day or that week. So, and we're also providing parental resources as the child matriculates through this digital intervention.
Well, that's really fantastic.
Mm-hmm.
And, getting back to this whole issue of how do we get fitness and the ability or the access to this out in the communities. I recall when I was working in the disease management program, we recommended to one of the facilities that it was a resort, that they allow their staff to use the gym. And they said, oh, yeah, that's a great idea. We'll go ahead and do it. And then as we talked to the staff, none of them were accessing the gym. And we did a quick survey to figure out why this was happening. And it turned out that this was a direct quote from one of them. I don't feel comfortable going into that gym wearing my cutoff shorts, when everybody is in these full-blown workout outfits who are attending the resort. And we actually came up with a fairly simple solution, which was we asked the resort, can you supply each of these staff members who are interested with your workout kits that you sell? And they did. And suddenly they got access. So you really have to look at this a little more broadly, don't you?
Yes. And, and when I look at a fitness center, that should be a place where it is an equal playing field. I mean, when you're helping someone to be healthier, I feel personally that it's a right to know the basis of how to be healthier. What is a hamstring? What is a heart rate? How do I check my heart? Those things should be basic in order to maintain an average healthy lifestyle, right? Just the base things. And so providing things like shoes. I know we have clients that come in and it's even more severe. I mean, they're just embarrassed. We've had people that say, I have no idea what to do at all. So to have someone to be there and say, hey, let me show you where the instructions are on this piece of fitness equipment, just to have that, because you'll be amazed. Well, you might not be amazed at all of the things that come up and get in the way of people actually moving forward on their fitness and health journey.
And you talked about this. So it sounds like a fair amount of it is not just exercise around fitness or how to use a piece of equipment, but just general exercise about health and health literacy, things like that.
Yeah. How do you know when it's been effective? If I can't self-assess and notice that my sleep quality is better, or to notice that my heart rate is not as high as it used to be, how do I know what to even look out for? Things that increased physical activity actually improves and helps. You need to know what those things are so that you can see that it's working, because we do know that when you feel as if you're not getting results as fast as you think, that's another reason people kind of slow down on their fitness journey and maybe stop or halt or pause. And so to be able to know what you should be looking at first, I think that's very important, because, fitness works from the inside out. Your digestive system gets a little bit better before those inches go, right? You feel better walking up stairs before the inches start to leave. So if people really knew to look at those things, I think that would help, kind of a positive reinforcement to them staying on their fitness journey.
You're making me laugh because I'm sitting here going, she's right on target. I feel better, but the inches haven't gone.
The inches haven't gone anywhere. Yeah. And so I have to have, and that's why when we work with individuals, I do think we don't always work one-on-one. It might be semi-private, but we do try to keep our training class as small as possible, because every individual has different needs. It doesn't, I mean, I don't care what your age range is. You know, someone who is 50 might have hurt knees, like some of my 20-year-olds have hurt knees, and all of them have to be modified when you're doing a squat, right? And so looking at that and really figuring out what is it that you need. And the beautiful thing to me as a fitness professional is that they have no clue when they first come to me. They have no clue of what they need. They just know the basics of what they're seeing, right? They know that they want to be smaller. They know that the doctor said that they need to lose weight. They know that their liver needs to be better, right? They know these things, but they have no idea what they really need. They need to be educated on what is a hamstring. They need to be educated on, when I say perform squats, they don't start raising their hands. There's so many small things that I think people overlook when it comes to fitness, and they just expect that people naturally know, and they don't. They don't.
And if you're just tuning in, you're listening to Pop Health Week on Healthcare Now Radio. We're speaking with Astria Goolsby, the owner-founder at Verve Health Station.
Right. We all have to learn this stuff, you know, and it's just about exposure. So you've talked about training other trainers. Is this a model that we could get out into communities? In other words, train people out in communities to take it to their neighbors and friends, et cetera?
You know, I'm so glad you said that, because a small vision of mine, I have lots of visions, but one of the small visions of mine, you know, I have this vision of 100 real trainers. Like, the more people that become actually certified trainers, the healthier we'll actually be. Because once you become a trainer, you know, per se, you feel this sort of responsibility to be healthy yourself, right? And if people understood more, listen to where I'm going. If people understood more of what does a trainer know, and what is the trainer going to show me and teach me? And so when I was at Tuglu, I would have community members that would come to my certification workshops, and they would say, I just want to know, what does the trainer know? And it actually helped those people, it's been about 3 or 4, to sustain their fitness journey. Because some people don't feel like they need a trainer, but if you educate them on what trainers know. So I was like, you know what if I did some sort of certification or a credentialing of some sort for just community members to come in and take a small piece of a personal training certification course and just basically learn how to put together a basic fitness program, learn how to nutrition journal, learn what protein, carbs, and fats are. Just kind of know those things. How far would it go? And then we came up with the total wellness curriculum, in which we actually teach students what the trainer knows as far as putting together a fitness program, and it works.
Wow. So I know there are these programs out there, like Silver Sneakers is an example, you know, through a health plan, but those typically require, one, they get the worried well, or the people who like to work out. Hey, I'm going to join that. I can go to the gym for free or whatever. And obviously it'll draw some others. But is there a way to take this model sustainably out into the community and work with what is currently there?
Is there a way? You know, we're going to have to provide those fitness professionals who are credentialed. Honestly, I've been working at it, and I can't seem to get around that part. We're going to have to make sure that these fitness professionals are credentialed to be able to understand the effects of increased physical activity and how it affects chronic disease and chronic illness. That education piece is going to have to be in there, and providing those fitness professionals to these communities. And they can be in small settings, they can be broken up into different large settings, but that's going to have to happen. Now, I would love to work with you so you can help me figure out how this model is sustainable, because it is going to cost, it's going to be an investment. There's an investment that's going to have to be made, but I think the investment will have a return on it, because if you look, to me, jobs are needed. And if you can
Absolutely.
make being a fitness professional a sustainable career, I think we might be onto something.
Or perhaps do it this way. You know, we're now recognizing years later that the 1950s public health model of community health workers, or promotoras that have been in the models in that group for years, and we used those in the communities back in the day. But it never occurred to me to think about this a little bit. Why not? that perhaps we should have done some more education for those groups on things like fitness and exercise. Yeah, we started a few walking groups, but mostly we focused on their healthcare issues or what they were eating and things like that. So maybe it's about developing a certification or a training program for community health workers around fitness coaching.
Either that or taking fitness coaches
Exactly.
and making them into community health workers. That was really my thought process because,
Uh-huh.
I'm going to be honest, to be a fitness professional in 2023 is a calling. For you to actually get out here with people and to be able to have the patience, to be able to, to want to help people, because it's so, the culture makes a difference on how you train who. Educational background of the person that you're training, you need to know how to cope with that. We call it spices. You have your social wellness, your physical wellness, your intellectual wellness, your cognitive wellness, your emotional wellness, and your spiritual, right? You have to be able to change up with each individual person, and that's very hard to do in a huge group of people, to really connect with them and to get them to take in what you're saying. So I really see us taking people who ground level, foundationally are fitness trainers and providing that health, that health worker concept to them. And I think that might be a little more sustainable. What do you think?
Yeah, no, I think that's a really fascinating idea. And you just talked about spices, and these are the spices. That's a great way to talk about that. And I'm picturing my spice closet right now and what might be missing, and I guess that's how you look at that.
Yes, picture your spice closet and what might be missing. Serious, and that's when I do the workshops, because I use the National Federation for Professional Trainers. I use their certification. To me, it's low cost. It's the least expensive one to get you started, and then you can spread out from there. Become a clinical, whatever, work with cancer, work with children. But you need that good solid foundation, right? And so I really stress spices. I really stress total wellness. I stress self-responsibility of the client. I stress don't date your clients. I stress that. I am a big stressor. Do not date your clients. I really stress for them to look at those social, cognitive, occupational, look at their wellness, because those are going to be the reasons why they can't attend the sessions. That's what's going to get in the way. Though there's something in that spices closet that is missing, and it's up to us to be able to stay focused and recognize it and provide those resources for them to be able to fill their spice closet. I'm going to use that, Fred. I love it. Spice closet.
Well, thanks so much, Astria. I think it's an incredible area. So where do you go next? You're like a dynamo here, thinking up these things and working in this area. It obviously is a place that makes a difference. Where do you go next?
Where do we go next? Right now, we're in the school systems. And so, this really has been a calling, because everywhere I say I'm going, Fred, it doesn't work that way. I start writing proposals with these big ideas, and then Tougaloo called. Right? The Oxford School District called, UMC called, and I was like, I have to go. I can't just sit here and I've noticed that when I'm just kind of submissive to where my path is taking me, it's all coming together. I started out over 15 years ago. It's so funny. I started out working with school health councils. That was one of the programs. And from that, I wanted to see, how can we bring trainers into the schools? How can I do that? And 15 years later, now here I am working in the schools, some of the same schools. And I'm bringing diabetes prevention, which is really needed. And it has that physical activity component. I have the ability to reach school health councils and say, hey, you need this. I have the ability to reach the parents. I have that format. So I really feel that in the schools and education is really where I'm kind of being pulled to. But we're still bringing training. We're still bringing education. I'm still working with the parents of the children. I never thought about that kids have parents and parents have children. So who I'm training in the real world have children, like it's all connected. And the school seems to really be, between schools and churches, that seems to be where everyone is going to go. It's like a gas station. Everybody has to go to the gas station, right?
Yep.
No matter what, everybody has to go to a gas station.
So I think it's time to develop a little 3-minute fill up your car with gas fitness program right there at the station.
Where is my pen and paper? I wasn't expecting
those little screens that they have that they're showing some little film on or something while you're filling your gas. They can do a little exercise routine for you or education. There you go. So
I love it.
It's fascinating.
But education is it. Yeah. Education is where it is.
Absolutely. Well, I mean, it's amazing, the different areas you've worked in and the stuff you're working on now with DPP. I think it's really something that hopefully people will recognize. You talk about the schools. I mean, there's been arguments for years. All we're doing is taking out physical therapy. We don't, I mean, physical exercise. We don't have that in the schools anymore. We took it out. We used to run all the time and do that kind of stuff. And no, we got to spend more time sitting down in the classroom. It makes it really tough on kids.
It does. And, I do look at, if we know what all the studies say about kids and about, not just children, anyone being, able to absorb knowledge a little easier when you have adequate physical activity and water and good nutrition. If we know these things and we know we want these testing scores to go up, even if it's during testing time, could we say, while we're prepping for testing, that's when we actually insert exercise. I'm willing to work with whatever it is that we have. If we can't seem to get recess back in there, where does it fit in? Because to me, if we're looking at all the studies, we've got to say, it's coming. So why don't we go ahead and do it now? And with all the technology, I think that our barriers really are limited at this point. I think it's time for us to kind of execute what we know about fitness. And I did use the scary term fitness, not just physical activity, but fitness. I think that's important to start at this time in our country, to start really talking about that word and what it really means and how to take it seriously.
Well, I think, Astria, that's a fantastic way to end this show. It's been really a pleasure getting you on and discussing this broad range of topics around fitness. I really appreciate your time.
No problem. Thank you, guys. I can't believe that was really quick. I had a great time. Thank you.
And back to you, Greg.
And thank you, Fred. That is the last word on today's broadcast. I want to thank Astria Goolsby, the owner-founder at Verve Health Station, for her time and insights today. To learn more about her work at Verve Health Station, go to www.vervehealthstation.com and do follow Astria's work on Twitter via @ask_Astria. And finally, if you're enjoying our work at PopHealth Week, please like the show on the podcast platform of your choice, share with your colleagues, and do consider subscribing to keep up with new episodes as they're released. We stream live on Healthcare Now Radio weekdays at 5:30 a.m., 1:30 p.m., and 9:30 p.m. Eastern, and for you left coasters, 2:30 a.m., 10:30 a.m., and 6:30 p.m. Pacific. For Pop Health Week, my co-host Fred Goldstein, this is Greg Masters saying, please stay safe, everyone. Bye now.